background on this RFA and our work and what some of the thought processes are. I do want to share that I'll be recording this session and sharing it out on the BSK blog so that other folks are able to access this, and we'll also be taking notes on any questions that folks have so that you'll be able to come back to our answers. So as I mentioned, this solicitation includes funding from our CDC grant as well as from our BSK grant. And that does have some implications for the way that we will monitor the grants and who you'll be working with on the contract side, which I can go into. But a little background on our work. We focus on communities that are disproportionately impacted by lead, including communities of color and low-income communities, refugee and immigrant communities, children who are enrolled on Medicaid, and children living in South King County. And those communities we focus on for a number of reasons. Some is due to particular exposure sources that put folks at higher risk, and then some are because lead is an environmental justice issue and it's related strongly to housing quality and the neighborhoods that you live in. So we focus on low-income communities because of housing quality, as well as the Medicaid communities. One of the issues that we've been trying to address over the years that we've had this funding is really the limited awareness in the general public of the issue of lead, especially in the Northwest. We hear oftentimes families and even medical providers saying that they don't really feel like lead is an issue in the area, despite the fact that we do see lead cases fairly regularly, and we just know it's impacting particular communities at different rates. We also know that lead is entirely preventable. Lead poisoning is entirely preventable, and it's something that we know and have best practices for addressing. We also are focused heavily on increasing the testing rates in Washington and King County for lead testing because we have some of the lowest testing rates in the nation. Again, that goes back partially to medical providers not feeling like this is an issue or prioritizing testing. It goes back also to folks just not being aware that this is something that they can ask for or what the risk factors are so that they know to advocate for testing. And currently there are policies in place where legally all children who are enrolled on Medicaid need to be tested for lead at 12 and 24 months, but we still are seeing many doctors who are not following through with that testing. We're also really interested in public health surveillance and understanding what emerging sources of lead exist in the community. For example, there can be instances of food being a particular exposure source that we only find out by testing because a lot of kids are coming forward with high lead levels in their blood and then they test positive and we do an investigation. That's how we figure out that there is a new source of lead in the community. And we want to work specifically with communities to understand what areas they have concerns in, what we should be testing and looking at, and creating messaging that is culturally appropriate and responsive to what different communities are needing. The other area of interest is limited resources or support for renters and child care facilities and schools around mitigation and abatement, so the removal or the stabilization of lead. We've worked in the past with the the tenants union to try and get more education to renters around what their rights are, as well as to begin conversations with landlords about what their responsibilities are. And we'd like to continue that work with a community-driven programming. So thinking about what people want to see, how policies actually affect them, and ways that we can make them stronger. So that's a little background on our work. And I want to just say welcome to all the folks who are coming in. We are recording this session, so please know that we are recording and it will be posted on the BSK blog for folks who aren't able to sit in on the session or want to listen back. Right now, I'm just going over some background on our focus areas as well as the work we've done in the past But I'm going to really quickly pause because this time is really for all of you to ask questions. So if there's any questions, please feel free to unmute and we'll do our best to answer. Okay, great. I'm going to keep going. So as a part of this RFA, we have two different projects that we are funding. And one of the projects, which we were calling the action groups, we've done in the past, and I know we have some subrecipients in the past who have worked with us on these action groups. And they're essentially like a steering committee. They're a group that will work with us to help create an action plan for the next 5 years of our funding related to a specific topic area. And I thought it'd be helpful because there's 3 different action groups that have 3 different focuses, but they all have the same deliverables. So the action groups will be expected to kind of create a very basic group charter, depending on how many organizations there are, that just lays out what the roles and responsibilities are and what the timeline of work is for this first short period of funding for 6 months. And they also will be asked to create an action plan. And this is what will be implemented over the next 4 years of funding. And it'll include a description of the group's priority areas and a high-level work plan of the types of projects they would want to see moving forward. And it could include things like the outcomes and deliverables they'd be interested in seeing, a description of the audience of who the projects would target, and the anticipated resources or expertise required to make these projects happen. And then the product action group, so there will be 3 different action groups, and the product action group is one. And this is a brand new action group that we haven't had before. And it's in response to that, the need for a better understanding of lead exposure sources in the county. And so in addition to creating an action plan, the product action group will also help us think through what educational materials we're missing, especially specific to different consumer products. So for example, coal and surma has historically been found to have high levels of lead in many of the different varieties available on the market. So how do we create messaging that's appropriate to communities that use coal and surma? What languages do we need to get them in? Things like that. They'll help us just kind of think through what educational materials we need. And they'll also coordinate with some other groups that are doing work around products in King County and other community organizations that are doing work around products. So those are just some additional deliverables for that group. And the product action group's goals is to provide education and outreach to focus communities and influential parties on the danger of lead in products and ways to prevent lead poisoning. And when I say influential parties, it could be store owners who are selling products that may have lead in them. It could be schools that are using toys that may have lead, or caregivers. And then really the main push is with focus communities and making sure we're getting information out. The other component is just to improve public health Seattle counties and the community's understanding of sources of lead exposure, and developing community-led strategies or policies for removing products with lead from homes, schools, stores, and child care centers. And we've done some work in the past with providing free resources to child care facilities like nap mats that are toxic free. So it could be something along those lines, or it could be more of an educational campaign, and we'll work together to decide what feels best. The other action group, which we have had in the past, is the healthcare action group. And this will be focused on strengthening community and medical provider partnerships, increasing blood lead testing and referrals for developmental services, and increasing awareness of testing needs and prevention strategies in general amongst medical providers. And last year, the group that was a part of this healthcare action group put together a a continuing medical education and a continuing nursing education training that is still online and available for free through the King County Medical Society. And they worked with medical providers and community members to discuss lots of different topics related to lead and also address issues of bias and racism within the medical provider community that could be lowering the rates that certain communities are getting tested, and just creating a bit more of a connection and understanding to why this issue is important for different community groups. And then the final action group is the housing action group. And this will be focused on, obviously, lead in housing and strengthening partnerships between housing providers and community, educating housing providers and focus communities on the dangers of lead, and building community capacity and knowledge of housing rights and protections, and improving policies and systems in place to promote lead-free, healthy housing. And we've done this work group as well in the past. And last year, what they did was a series of trainings with property managers and landlords around lead and what they're required to provide tenants. We also did some initial learning sessions with community about with the Housing Tenants Union around what rights folks have. And we'd love to continue that work and thinking about how folks are experiencing policies in the real world and how we can strengthen them. So again, I'm going to pause there and just recap, because I know that was a lot. So the action groups, there are 3 action groups: housing, healthcare, and products. And they each have the same exact deliverables. They'll each be expected to create an action plan that we'll use to inform our work over the next 4 years. And for folks who are interested in applying to these action groups, you can apply to just one, you can apply to all 3. It's totally up to you and dependent on your organization's capacity. And we're not necessarily looking for folks who have experience in, housing or healthcare. We're really looking for folks who are interested in those areas, have some experience, creating community-based programming, but really folks who are interested in bringing community voices to these issues and helping us guide this work. And we can, partner and figure out who else we need to bring in to make these things happen. But really, we're looking for folks to just help us center our work on community and what people need and what is happening on the ground. Any questions about the action groups? Okay. Well, welcome everyone who's just joining us. I am just letting folks know that we are recording, and this will be shared on the BSK blog for folks who missed the session. I've just gone over a little bit of background about our work and areas of focus, as well as the action groups, specifically what goals each of the action groups have and their deliverables. I'm going to keep moving forward, but if there's any questions related to that, please feel free to pop it in the chat or unmute and ask a question, and I can circle back for folks who missed it earlier at the end. So the other big component of this solicitation is the product testing events. And we're really excited to have funding to be able to support these testing events. It's something brand new for us. And it'll be separate from the action groups. So you can choose to just apply for the product testing events, or you can choose to apply for the testing events and whatever combination of the action groups you'd be interested in. With the product testing events, what the organizations will be responsible for is scheduling events, doing outreach and promotion for each event, tracking any incentives that are given out to the community members, so cash value cards or gift cards, and creating a report for each event showing how many people attended and other details that we'll decide on together that we feel is important for tracking the success of the events. And the goals of these events are, again, to just increase awareness amongst folks' communities of lead in products and ways to prevent lead poisoning, to help us, public health, gather information on current and emerging sources of lead, and to prevent lead exposures by developing strategies to reduce the availability of products containing lead. And at the events, Public Health Seattle County staff will be available and present, and we will bring all of our materials and resources as well as our XRF machine. So community will be able to bring in household items and things like spices that they have concerns about or are curious about, and we'll be able to test them on the spot and let them know if there is lead in the products. And if there is lead in the products, we can provide recommendations on safer alternatives. And we will also bring materials on everything from how to get tested for lead, how to test your soil, everything community needs to know to continue learning about what could be exposing, if there are any exposures in their home. And this could be dependent on what your organization wants to do. It could be in combination with another event, if that would be of interest. If you have a health event regularly or a summer block party and you want to combine that with this would be a great opportunity. There's a lot of flexibility in how this happens, and we're happy to do presentations, really whatever works for your staff and your community. Because of COVID, we recognize that the in-person testing can be hard. So we've also done kind of drop-offs. So families would label their products, drop them off. We would test them, and then we'd send them a report, and they'd have to come pick up their products again. But we want to be really flexible and safe and meet the needs of community. And then that data that we get from these product testing events will be reported back to the product action group, so we can start thinking about what we're seeing in the community in real time and what we should be focusing on for messaging. Any questions about the product testing events? Okay. So for the all of the folks who are joining either the action groups or the product testing events, there are some baseline requirements for being a part of our funding, and that includes attending an introductory lead training, which our staff will put on. It'll be about 2 hours at most, and we'll just go over the basics of lead poisoning and common lead exposures and backgrounds on who's affected. We will also likely have evaluation planning meetings for the product testing event. We'll be working with the BSK evaluation team, and for the action groups, we'll either be working with an outside consultant or with our own team to create evaluation plans together to decide what we want to track for success, to understand the success of the programs. We'll also ask your team to meet about bi-monthly with lead and toxic staff just to check in and make sure that everything's going well, see if you have any questions on invoicing or anything like that, and provide technical assistance. And then there is an annual fiscal and program site visit that all folks are required to take part in, and that would likely be in September with our fiscal team. All organizations will, of course, be responsible for managing their own budget and submitting timely invoices. Jeff, did you have anything you wanted to add from the contract perspective? Is there anything else that folks need to be aware of?
Yes, I did want to go through the RFA document and cover a couple of items that agencies should be aware of.
Okay, why don't I pause here and give you the stage.
Great. Okay, well, I will, again, my name is Jeff Brown, for those who came in a little bit later. I am the contract specialist who is overseeing this particular RFA. And as Ashley mentioned, because there are two different streams of funding, both CDC funding and BSK funding, that will equal two different contracts that you have, since we don't mix BSK funding with other funding. So you'll likely interact with my colleague Phil Thompson, who will be doing the BSK side of these contracts. I will be doing the CDC side. Because there are two different types of funding, I do particularly want to cover some of the federal issues that you may run into for those of you who are new to federal funding. And there's a little blurb in the RFA document in section 1.24 that talks about the inclusion of federal funds. This only applies if the contract that you are awarded contains federal funding. So if you get a contract that is 100% BSK funding, you don't need to worry about this. But if you get a contract that has federal funding, please be aware that we will be considering you as federal subrecipients, and there is information in the RFA in section 1.24 of what funding it is. It is CDC funding, and if your ensuing contract is over $25,000, we are required to enter that into a federal database under what's known as the Federal Funding Accountability and Transparency Act. And in order to do that, we need you to be registered in sam.gov. So if you've had federal funding in the past, you know that it's fairly simple. It's free. You just go to sam.gov, you register as an entity. They give you a unique entity identifier. In the past, this was a DUNS number, but beginning April, that is changing over. They will no longer be using DUNS numbers in sam.gov. Everyone will be getting a unique entity identifier. So if you are already registered in sam.gov, you should be aware of that, and you probably would have received your what they're calling UEI already. If you're not yet registered and you are planning on or will have federal funding, you will need to register in the system. Other items that will apply to everyone that I just want to point out. This is the only pre-application conference that we're doing. You do have until close of business on March 17th to ask questions. So if you don't have any questions today, tomorrow you may think, oh, I wish I would have asked this question. You can still do that. Please submit that in writing to the address, the email address on the front cover of the RFA, cpress-ehs@kingcounty.gov, and we will get a response back to you as quickly as we can. It is best to do this in writing, as if you were to call, I can't guarantee that what I'm going to tell you is accurate, and it does take a little bit longer to do that. So please submit that in writing. Please also note that you are neither the staff nor you are allowed to interact with one another regarding this RFA. If you have an agreement with public health about something else, you are certainly free to talk about that, but talking about this RFA with anyone other than myself is prohibited. Section 1.8 does have the tentative schedule for this RFA, and as I mentioned, next Thursday the 17th is the final day to ask questions. If something comes up today that we need to issue an addendum, we certainly will do that. And if by the end of next Thursday something else may have come up, we will also issue any sort of addendum that clarifies information or gives additional information. If nothing else comes up, we will not issue any addenda at all. But the final addendum will be issued, if necessary, by next Friday, the 18th. And then after that, the applications are due no later than 2 p.m. on March 24th, which is 2 weeks from today. And that should, again, come to the email address cpress-ehs@kingcounty.gov. And we will get back to you when we receive your application. It may not be right away, so please be patient if you don't get a response back right away. But someone will get back to you letting you know that we received your application materials. What should be included in the application is in section 1.15, and basically answering and reply, attaching all of the different attachments that are included, 1, 2, and 3, and 4, and filling out the information on those as applicable to whatever you were applying for, and then submitting that in the email to us. I believe I have not yet talked to Ashley about this, but I am thinking I probably will post either a Word version or a fillable Adobe version of these application materials to the website. So that should happen within the next few days. So please check back early next week, and you'll be able to download a version of the application materials that you can then type in and fill out without having to print them out and fill them out that way. The only, I think the only other thing I do want to point out, a couple of other things. One, we do anticipate that this may be a multi-year agreement, but we will only be doing this in 1-year stages. So you will, the first agreement you get will be for the first year. And if we do continue to get funding and if the progress is satisfactory, we will look at continuing these agreements for additional years. And you can read more about that in section 2.6. And then finally, please note in attachment 4, this is your agreement to, it's not just your agreement to accept our terms and conditions, but it also is information about who you are and what organization you are and who we need to contact. So this is who we will contact to let you know if you were selected or not selected. So please fill out this information and turn it in with your application materials. Referencing attachment 5, the sample terms and conditions, these are what will make up your contract with public health. If you do have one that includes federal funding, please note that Part B will be part of that agreement as well. And these include the federal terms that are part of this CDC grant. And you will be required to abide by those as well as the King County terms. That is all I have. If any of you have any questions about the RFA or the subsequent agreements, please let me know. But I will turn it back over to Ashley.
Thank you, Jeff. And thank you, Alex, for attending. Appreciate it. Are there any questions after what Jeff shared? Okay. I'm just going to continue going through.
I have a quick question.
Yeah, please.
How many organizations do you anticipate funding for the product testing?
Great question. We are anticipating having, I think, up to 8 organizations. We have a little flexibility on the funding, so we're interested in getting as many new folks in through that as we can. But I think around 8 will be the maximum right now.
Thank you for the information about the type of funding. Because my organization, we have a fiscal sponsor, and our fiscal sponsor is not set up or have capacity for federal funding. So we're looking to, and I'm glad that I attended, is to know which program to apply it to. So yeah, thank you.
Yeah, great.
And since you did mention, since you did mention fiscal sponsor, I do want to point out that if you do have a fiscal sponsor, it is the fiscal sponsor's responsibility to apply to the RFA, and they will need to include your information as part of their application materials and let us know that they are applying on your behalf but our agreement will be with the fiscal sponsor. So if you were to apply and be awarded the grant, but you are covered by a fiscal sponsor, we could not give you an agreement because it's not the entity that is the legal authority over you, if you will. So we need to have your fiscal sponsor be the one to apply to the grant.
Yeah, that's how it is. But I just I usually write the narrative, and then the grant support person from the fiscal sponsor office support around that. But we do just put their EIN number on there. Is that what you're saying? And then there's a contact person at the fiscal sponsor's office email that to receive contracts and sign them. Is that what you're saying?
Yeah, it's basically for purposes here, attachment 4 would need to be completed by the fiscal sponsor, and since this application is a little bit different with the application materials that we have, so it is a little bit different. But yes, attachment 4 would need to be completed by the fiscal sponsor, and the email would need to come from them, and then you could fill out the other attachments since it's more programmatic in nature. And then, we would have the agreement with the fiscal sponsor directly.
Yeah, that's normally what happens. Thank you.
Yeah.
Clarifying that. Yeah.
Great. And just to clarify for folks who didn't see it in the chat, the CDC funding is covering the action groups, so the housing, healthcare, and product action group, and the BSK funding is covering the product testing events. Thank you for that question. Any other questions? The presentation will be put up on the BSK blog. I can, and if I can grab that, maybe Amy or Leslie or Najma, do you mind putting the link to the BSK blog in the chat for folks who have it, can have it? And I believe there's just a site, and I'll put up these slides as well. So you'll have these slides, you'll have the notes on the questions, and you'll have the recording. And so one other thing I just wanted to briefly talk about with the action groups is that there are two different levels or positions that you can apply for within the action groups. One is a lead organization who would essentially be the ones organizing the action group, leading the development of the action plan, and overseeing the reporting of meeting agendas, attendance, and notes. Or you can be a participating organization who would be attending the meetings, assisting in community engagement and information gathering, contributing to the action plan, and then tracking and reporting their own contributions to the deliverables. So tracking what meetings they're attending and reporting on anything like if they do a presentation, they would send in their PowerPoint slides, things like that. And so there is a difference in the payment for the two different roles. You can see that the participating organizations are up to $8,000 for the housing and healthcare and $11,000 for the product action group. For lead organizations, it's $15,000 and then $18,000 for the product action group. And the difference in those action groups is because of the extra deliverables that the product action group will be expected to complete. And those are really related to coordinating with a internal public health Steelton County steering committee that we have, with some of the organizations who are doing the product testing events, to just hear about what they're seeing out in the field and to help us with thinking through educational materials related to products. And again, the payment amounts are up to, so we part of the application includes some information on your proposed budgets. That will not be used to score your applications. It's more of a starting point that we will use when we have a conversation about budgeting to make sure that we're on the same page and we can start right away jumping into budgeting and contracting. So if you have any questions on that, you can feel free to reach out to Jeff, but it should just be really high level what you think what your proposed budget would be for this type of project. And this is just for the contract period from April to September 2022, which, as Jeff said, there will be an opportunity for 1 year of extension if we continue to receive funding. And in the second year, it would evolve more into actually doing the work in the action plans. And I see Megan is asking, if you apply to the lead organization and aren't selected for that role, is there any opportunity to be a participating organization instead? And yes, so for the lead organizations, you will you just have I think 2 additional questions. And so if multiple folks go for the lead organization position and someone isn't selected, we will still score them as a participating organization, and they will be given the opportunity to be a participating organization. And a little information about our contracts. As I said, this is for the contract period of April through September. We typically do performance-based contracts, which means we will decide on a budget based on the work that needs to be completed. And then the product testing events, it's important to know that because it's BSK funding versus the CDC funding, if you're applying for both an action group and a product testing event, you will have 2 separate contracts, as Jeff stated. And Jeff will be working with the CDC contracts for the action groups, and Phil Thompson will be working on the product testing event contracts for BSK. We will work as closely as possible with the fiscal teams to make the fiscal monitoring simple for folks who are receiving BSK and CDC funding. The CDC fiscal requirements are a lot stricter than the BSK requirements, so we're working with the 2 different fiscal teams to align those, and most likely the BSK funding folks will just kind of go through the same process as our CDC folks. And okay, so some FAQs. Let me see, there's another chat. There's a wide range of funding for product testing. Is that dependent on number of events we lead as community orgs? Yes, let me go back. Yes, so yeah, thank you. For the 4,000 is would be for 1 event, is about what we're expecting. It'll be in the budgeting process. We'll talk to you about whether or not you want to have your events in person or virtually or a mix, and that'll inform the final budget. The 20,000 is the maximum, and that would be for applying up to 5 events. So each org can apply for up to 5. And we see the 4,000 as kind of the cap for a in-person event. If it's a virtual event, it'll likely be a little bit lower, but we'll discuss in the budgeting process. So you would just kind of, in your initial application, tell us what you think it would cost for a event, how many events you're hoping to get sponsored for, and then we would work on the contracting end to kind of negotiate those details. And is there a specific number of individuals to attend per event? That would be something we would discuss with your organization. I know different folks have different levels. We've typically done around a minimum of 10 people per event, up to 20. I think that would again be something that would be finalized in the contracting phase. Okay. And I see Molly, sorry I was late, I missed this. Are the action group activities expected to focus exclusively on South King County? No, they're not expected to focus exclusively on South King County. That is one of our focus areas because if you look at the, I forget what it's called, the ESJ mapping tool, that's where we see an overlap in older housing, which is at an increased risk for lead exposure because of lead-based paint, as well as lower income communities where we know there may not be as much funding for things like abatement and mitigation, which can be quite expensive for lead-based paint. So that's why we focus in South King County, but it wouldn't be exclusive. We've done, with healthcare providers, we are doing work with Virginia Mason and Harborview, which are more in central Seattle, but we'd be interested in across King County. I'm going to keep moving. So FAQs. As I said, organizations can apply for as many of the action groups or the events as they would like, or any combination of them. It's really just dependent on what your time and your staff availability. Again, the product testing events are BSK funded and the action groups are CDC funded. The contracts will be separate. So if you're doing the product testing events, you will have one contract. If you're doing the action groups, you'll have a separate contract. And do organizations need to have a background in lead or toxics? And the answer is no. Really what we're looking for is any combination of expertise in the areas of interest, like the housing, the products, and consumer rights, and healthcare organizations, as well as strong ties to communities, a passion for environmental justice and health equity, and experience working collaboratively to design community-driven programming. We have 3 educator consultants on staff, as well as our manager, Amy. We have lots of connections with medical providers and the Tenants' Rights Union. And so we have lots of folks to support one another and bring expertise, and we want a well-rounded team of folks. So you do not need to have a strong background in lead if you have an interest in creating community-driven programming. And I'm going to go next to our timelines. So the action groups, we will be announcing the who is selected for funding in mid-April, and then we will begin the contract and budget negotiations. Our goal is to have the first kickoff meeting and the lead training that I talked about in early May, probably, though it'll be closer to mid-May. And then the action groups will begin, and we'll find some time for evaluation planning within those action groups. And then the goal is for the action plans to be completed by late August, early September, with a final meeting for all of us just to review and discuss what the final action plan recommends. And then the contract ends on September 20th, and all project work needs to be completed. Invoices can be sent in a little bit later. We generally ask for invoices by mid-October. But the project work does need to be completed by September 20th. And here is the timeline for the product testing events, very similar. We will announce the product testing event fundees or subrecipients late April. We will go through the budgets and negotiations. Hopefully those will be a little simpler. And then the events will be able to start as soon as those are done in hopefully May. And we'll meet with the BSK evaluation team around that time as well, just to talk about what we want to track for success measures. I guess June will be when the product testing events really kick off, and September 2022 is when the events need to be completed by. And again, the timeline for finishing the invoices would be around October 15th. So any other questions? I wanted to pull up the actual solicitation to look quickly at the application questions and see if there were anything there that folks wanted to review or go over. So let me pull that up.
Great question.
Yeah.
Again, Janet, about the product testing, is there like a max staff hours for those that you can fund, or it's depending on the organization?
So we've been doing, so the way we have it structured would be like a set, do you mean like as far as the project management time, or like how long the events would be held for? Do you mind clarifying?
Yeah, that's what I mean. Like for each event, like, do you have a set hour that agency can bill for? So if I had 4 staff working on a project and we determined that for each event, 5 hours would be, is that something, or do you have, you know what I mean? Like, do you have a set? Yeah.
We don't really have a set hour right now. We would want to talk to each organization. I think that 4,000 budget amount per event is kind of the guiding number. Yeah, and that is pretty much, I mean, it would cover staff time, event space if that needs to be rented, and incentives if you want to provide, gift cards for community who attend.
Yeah.
And then our staff time would be covered, and we would bring materials and things like that for free. But yeah, the 4,000 is kind of the area to shoot for. And there is some flexibility there if there's specific needs that we need to talk about. But yeah, that was kind of how we were hoping to guide it. Is that helpful?
That answers the question. Thank you.
Yeah. I'm having a hard time sharing this correct document. I don't know why. Oh, it is working. Okay. So I just wanted to quickly go over this because just to make sure it's clear to everyone. So the first set of questions are really just for the action group, participating organizations, and lead organizations. And then the second questions are just for the lead organizations to answer. And these directly relate to the rating criteria that are also outlined in the document. And if I can find them, I think they might be up all the way at the top. So I just wanted to highlight that this is what we'll be looking at when we're looking at your questions and your responses, is really looking for that you have experience working with the focused populations that are outlined earlier, including children enrolled in Medicaid, families living in South King County, families of color, and immigrant and refugee families, as well as low-income families. And then demonstrated experience engaging community in programs and gathering community input on needs and priorities. We're looking for organizations that are being thoughtful about how they integrate community feedback and community voices into their work. And it doesn't necessarily need to be, formal evaluations and things like that, but just really how you're thinking about the ways you improve and continue to evolve your programming to make sure that it is truly meeting the needs of community. And the other component is really those project roles and responsibilities. And again, we're not looking for folks with long-term experience in lead and toxics. We're looking for folks who have experience working with community members on issues affecting their health and well-being, working collaboratively with community to develop culturally relevant programming, and a history of partnering and working with other organizations. So it's really more those skills, those soft skills of working together, working with community, and creating programming that is driven by community needs and voices. Are there any questions on the application questions specifically, or the criteria that we could cover? Okay. Well, that is all that I had planned. I see we still have about 10 minutes, so I can go back around and go over the action groups again, if that's helpful for people who just joined, or I can just leave this open for questions. Would anyone like to see more information about the action groups who joined later? Okay. I am going to pull that back up. Okay, perfect. Let me go to the beginning. So, for those who are who missed the beginning, I'm just going to go back quickly through the background and the action groups. And so the background is basically talking about why we focus where we do and why we have these particular action groups, which are the housing action group, the product action group, and the healthcare provider or the healthcare action group. Some of the things that we've really been focused on as a program over the years is creating awareness in the general public and the medical provider community about the issues of lead, because we often hear that folks in the Pacific Northwest think that lead is no longer a significant health issue. But what we know is that lead disproportionately impacts communities of color and low-income communities. And for those communities, it continues to be a serious health concern, especially because lead is 100% preventable and it's not reversible. So, and it can seriously impact a child's creating developmental delays and their nervous system, and creating behavioral health issues as well. One of the major concerns in King County and Washington in general is that we have very low testing rates. And this is despite policies that require all Medicaid enrolled children be tested at 12 and 24 months. We only test about 18% of children under the age of 3 at this point. And we would like to be closer to 50 to 60%. The other concern that we have is really keeping on top of emerging sources of lead exposure. Lead is used in a variety of consumer products, and we know that it is used in products like surma and kohl or henna, and it's been found in spices, but it can be challenging to know what particular items are affecting our community because we have such low testing rates, so we don't know who is being exposed to what. We also are interested in working on creating more resources and supports for renters, childcare facilities, and schools that may have lead. We've worked with the tenants union in the past around tenants' rights related to lead and what landlords are responsible for, and that's an area that still has a lot of room for improvement. So the action groups, the deliverables for the action groups are pretty simple. They include a group charter, just a basic group charter that would outline the roles and the responsibilities of the different organizations in the action groups and a high-level timeline of the work for this contract period. And then a action plan, which will be used to inform our project work over the following year. So each action plan will describe the group's priority objectives, what they're focusing on, and then for each project or action that they want to pursue, it'll outline the basic outcomes and deliverables that they would like to see from the project, a description of the audience, and anticipated resources or expertise that they think they will need to make this project happen. And then for the product action group, there's an extra deliverable, which is why you see a slight difference in the budgets available for the product action group. And this includes identifying and distributing culturally relevant educational materials and coordinating with organizations holding product testing events, as well as potentially our public health steering committee that are looking at consumer products with lead. And so the goals for the product action group is to provide education and outreach to focus communities and influential parties like stores or childcare facilities on the dangers of lead in products and ways to prevent lead poisoning, as well as to improve public health Seattle King counties and the community's understanding of sources of lead exposure, and to develop community-led strategies or policies for removing products contaminated with lead from homes, schools, stores, and childcare centers. The Healthcare Action Group, which is a group we've had historically, their goals are to strengthen community and medical provider partnerships, increase blood lead testing and referrals for developmental services through system and policy changes, and to increase awareness of testing needs and prevention strategies among medical providers. And this flyer on the right is an example of a project from last year that the action group worked with medical providers on, and it was a continuing nursing education and continuing medical education training that's still available online through King County Medical Society about the importance of lead testing for lead and preventing childhood lead poisoning. And then finally, the Housing Action Group goals is to strengthen partnerships between housing providers and community, educate housing providers and focus communities on the dangers of lead and healthy housing principles, build community capacity and knowledge of housing rights and protections, and improve policies and systems in place to promote lead-free, healthy housing. And I went over the product test. So the product testing events, again, the deliverables are really about the administration of the testing, so scheduling events, doing outreach and promotion for each event, tracking incentives if you provide incentives to community members, and reporting on the attendance for each event, as well as some other details that we will decide on together, whatever we feel is appropriate to track to understand the success of the program. And the goals of the product testing events is to increase awareness amongst focus communities of the dangers of lead in products and ways to prevent lead poisoning, assist public health in gathering information on current and emerging sources of lead, and preventing lead exposure by developing strategies to reduce the availability of products containing lead. And then to keep in mind, all organizations who receive funding through us will be expected to attend an introductory lead training where we'll just talk about some of the background on lead, common exposure sources, and some of the issues in King County that we're up against, as well as to attend an evaluation planning meeting, meet approximately bi-monthly with lead and toxic staff just to check in and see if there's any technical assistance that you need, and participate in an annual fiscal and program site visit, as well as manage your budget and submit timely invoices. And then again, this probably would have made more sense up near the action groups, but within the action groups, there is a lead organization position and a participating organization position. And the lead organization is essentially the project manager. They will help keep everyone organized, plan the meetings, lead the development of the action plan, track any reporting and documentation like meeting agendas and attendance and notes. And then the participating orgs will attend the project meetings, assist in community engagement and information gathering as needed, contribute to the action plan, and track their own organization's contributions to deliverables. So I'm going to pause there because I think it is almost 2:30. Is there any final questions? Okay, great. Well, as a reminder, this will be up on the BSK blog, which Amy has put in the chat. And for questions, you can reach out to Jeff through the cpress-ehs@kingcounty.gov email. We really appreciate your time and your interest in the funding. We're really excited about all these different opportunities, and we look forward to hopefully seeing your applications. Thank you.
Hi guys, Janet. I don't know if Jeffrey is still here.
Yeah.
I had a question about the application. I don't see anywhere on there where they're asking organizations EIN or even SIMS ID. Is that right?
Oh, I think, Jeff, are you still there?
Yeah, can you repeat that? You didn't see in the application where to put
EIN or SIMS ID or anything?
Yeah, we don't require that on the application itself.
Okay.
So if you have had a contract with us before, we have your EIN or
Okay.
and if you do get federal funding and need to get register in sam.gov, we'll get your information at that point.
Mm-hmm. All right. Thank you so much.
You're welcome.
Thank you.
Thank you.